Hello everyone, welcome back. Before you memorize another drug dose for your board exams, ask yourself one question. How does the body actually get rid of this medication? Because every exam, including the USMLE exam, internal medicine board exam, eventually tests one called pharmacokinetic idea, and that idea is clearance. Clearance determines drug levels, toxicity risk, maintenance dosing, dialysis decision, and even while two patients receiving the same medication can have completely different outcomes. In this video, we will master drug clearance, renal clearance from an exam perspective, and we will break down the essential formulas, understand what they actually mean physiologically, and learn how to solve board style questions quickly and confidently. And when we look at clearance, clearance is the volume of plasma from which a drug is completely removed per unit time. And when you look at different formulas that we can use to calculate our clearance, the first formula there that we can use to calculate clearance is the rate of elimination divided by the plasma concentration. So that means if the rate of elimination of that drug is increased, that means the clearance is going to be what? Increased. And of course, if the clearance is increased, that means the plasma concentration of that drug is going to decrease. The next formula that we can also use to evaluate clearance, clearance is equal to volume of distribution multiplied by the elimination rate constant. And elimination rate constant is the fraction of the drug eliminated per unit time. And when you look at the total body clearance, because the drug is not only eliminated in one particular organ, there are some drugs that they are eliminated through the kidney. Some of them could be eliminated by the kidney and even by the hepatic by the liver. So when we look at the total clearance, it's going to be a summation of the clearance of each of those organs. So for instance, the clearance from through the kidney plus the clearance through the hepatic and the clearance through the rest other organs in the body. And then the other formula that we can also use to evaluate clearance is based on the idea of infusion rate. So infusion rate equals to clearance multiplied by steady state concentration. So that means from this formula, I can say my clearance equals to infusion rate divided by what? The concentration of steady state or steady state concentration. And then why is this important? Because this will determine the maintenance dose. Your clearance determines maintenance what dose. Because if the clearance is high, if the clearance of that medication is high, that means your maintenance dose is going to be what? Is going to be, you're going to need high maintenance dose to be able to maintain the steady state concentration of that drug. And then this also guides dose adjustments in patients who have renal or liver disease. Because if a patient has a renal disease or if they have a liver disease, and that medication is cleared through the kidney, then in those patients, you might need to decrease the what? You might need to decrease the maintenance dose for those patients. And he also predicts drug accumulation, and he also tell the access to what? To dialysis, as we mentioned in the past. Because if a drug has a very high volume of distribution, that could affect the clearance of that medication. So now that we talk about the clearance of drugs, now let's look at renal clearance. So let's talk about renal clearance. So by definition, it's also similar definition, but it's just like we're focusing only on the kidney. So renal clearance is the volume of plasma completely cleared of a substance by the kidney per unit what? Per unit time. And you can see this formula is also similar to what we saw earlier. So here the clearance through the kidney will be excretion rate divided by the plasma concentration. And as we know that excretion rate is also the same thing as saying it's equal to the urine flow rate, which is going to be V. So V is going to be urine flow rate multiplied by the urine concentration of the substance. So urine concentration of that substance. And I'm going to divide this by the plasma concentration of that substance. And that's going to be the renal clearance. Looking at the clearance of inulin, the clearance of inulin equals to the glomerular filtration rate. Because if you look at our nephron, so let's assume that this is the nephron, right? And bringing in blood into the nephron is going to be the what? Is going to be the afferent arterioles. So it's going to be the afferent arterioles. And this is going to be the efferent arterioles, right? And as we know with inulin, right? Once your inulin is coming in, right, your filtration fraction here is going to be around what? Around 20%. And then the remaining is going to go into the peritubular capillary. So the remaining 80% is going to go into the peritubular capillary. And as we know, inulin is neither secreted nor reabsorbed. Remember, when you say secretion means some of those in the peritubular capillary, they are being what? They come back into the lumen of the nephron. So that will be secretion. Whereby reabsorption is some of what you filtered, or maybe all, are going back into the what? Into the peritubular capillary. So that will be reabsorption. But in inulin, with inulin, there's no tubular modification. So meaning that there's no reabsorption, there is no what? Secretion. So that means all the inulin that have been filtered, right, from the glomerulus into the Bowman capsule, all of them are going to be what? Excreted. So that means if I want to calculate the clearance of inulin, I can say the clearance of inulin equals to what? Equals to the urine flow rate multiplied by the urine concentration of inulin divided by the plasma concentration of inulin. And I can assume, because all the inulin that is being filtered through the glomerulus are all going to be what? Excreted. So I can assume that the clearance of inulin from the urine, that clearance from the urine is going to be equal to the what? To the glomerular filtration rate. So that will be equal to the glomerular filtration rate. So that's why we use the clearance of inulin to determine the what? The glomerular filtration rate, and that's the gold standard. And the other thing that we could also use is creatinine. So we could also use creatinine. But if you remember, once you filtered 20% of those creatinine, like the filtration fraction, once you filter about 20%, about 5% from this remaining 80%, about 5% of it is going to be secreted. So 5% of creatinine is secreted. So that means if you're going to use the clearance of creatinine, so if you're going to use clearance of creatinine instead of inulin, you have to bear in mind that clearance of creatinine will slightly overestimate the glomerular filtration rate. And why? Because of this 5% that is being what? Secreted at the peritubular capillary. And the last one there is pH, which is para-aminohippuric acid. So this is a good one to evaluate the renal plasma flow, because as your PAH, right, that is dissolved in the plasma, as it's coming through, about 20% is going to be, which is going to be our filtered filtration fraction. So about 20% will be filtered, and the remaining 80% are going to go into the peritubular capillary. But that 80% are going to be secreted into the what? Into the nephron. That means at the end of the day, almost about 100%, almost close to 100% of those pH will be what? Will be excreted in the urine. So that means I can use the clearance of PAH to evaluate what? The renal plasma flow. So that's why the clearance of PAH is going to be equal to urine flow rate multiplied by the urine concentration of PAH divided by the plasma concentration of PAH. And we can assume that this is going to be equal to the effective renal plasma flow. And the reason why we're using effective, because as we know, the secretion will never be almost 80%, right? So there might still be some that will be left there. And some additional formula from additional formula that we should also remember, one like I've been mentioned earlier, filtration fraction. And how do we determine filtration fraction? Is the GFR divided by the renal plasma flow. So once you know your GFR and you know your renal plasma flow, so once you divide your GFR by the renal plasma flow, that and you multiply that by 100 and 100, that will give you what your filtration fraction is going to be. And then the next one there is filter load. And then what's the formula that we use for filter load? So that's the GFR multiplied by your plasma concentration. So that means if you increase the plasma concentration of that substance, that will increase your filter load. If you increase the GFR, that will also increase your filter load. A classic example is the case of glucose. As you know, when you filter glucose, all glucose that have been filtered are going to all be reabsorbed back into the plasma through your sodium glucose cotransport, your SGLT2 receptor at the SGLT2 transport at the proximal tubule. All filtered glucose are going to be what? Be reabsorbed. But for instance, if a patient they develop diabetes mellitus and their plasma concentration of glucose is increased, if that's increased, then that will increase the filter load. And if the filter load is increased, this receptor might get what? They will get saturated quickly. And at that point, that patient will start to have what? Glucosuria. So they will start to have glucose in the urine. Or if a patient is pregnant, because as we know, with pregnancy, there is increase in plasma volume. So with pregnancy, there's increase in plasma volume. And because the plasma volume is increased, so that means that will increase the blood flow to the kidney. So that will increase our renal blood flow. And if the renal blood flow is increased, that means the blood that gets, we're going to have more blood getting to the glomerulus. And you can remind us which pressure will be elevated. Very good. So that means you're going to have increase in glomerular hydrostatic pressure. And as we know, that glomerular hydrostatic pressure normally pushes fluid away. So that means that will increase what? That will favor increase in glomerular filtration. So that means glomerular filtration rate will be increased, and that will increase the filter load. And that's why with pregnancy, you can see what? Glucosuria. We see glucosuria is not because the plasma glucose is high, it's because there is increase in plasma volume, thereby increasing the glomerular filtration rates and then increasing the filtered load. And the last formula there is going to be renal plasma flow. The renal plasma flow equals to the your renal blood flow multiplied by 1 minus hematocrit. And that hematocrit is going to be in decimal, right? So for instance, if your hematocrit is 45%, you're going to convert that to decimal and down to be 0.45. And that's what you're going to use. So from here, I can calculate my renal blood flow. So that means renal blood flow, the renal blood flow is going to be equal to my renal plasma flow divided by what? 1 minus hematocrit. And that will give you your renal what? Your renal blood flow. And this is a very important, well-tested concept on the exam. So now that we've learned about drug clearance and renal clearance, let's do some questions together. So the first question there is: a drug is administered by continuous IV infusion and reaches steady state at a plasma concentration of 10, and the infusion rate is at 50 milligrams per hour. What is the clearance of this medication? And as if you remember earlier, we said that the infusion rate is equal to clearance multiplied by steady state concentration. So from here, we can make clearance the subject of the formula. So that means clearance will be equal to infusion rate divided by the concentration of steady state or steady state concentration. And our infusion rate here is what? Is 50, and our steady state concentration is 10. So 50 divided by 10, that will give us 5. So that means the best answer there is going to be 5 liters per hour. So moving on to the next question. A drug has a plasma concentration of 10 milligrams per liter. The rate of elimination is 50 milligrams per hour. What is the clearance of this medication? And as you remember our clearance, like we mentioned earlier, is the rate of elimination. So the rate of elimination divided by the plasma concentration of the substance. And the rate of elimination here is what? 50. And the plasma concentration of that substance is 10. And that also gives us what? 5 liters per hour. So the best answer there will be B. I'm looking at the next question. A drug has a renal clearance of 60 milliliter per minute and the hepatic clearance of 40 milliliter per minute. What is the total clearance? Remember, I said that the total, when you look at the your total clearance is going to be the clearance that is done by the kidney plus the clearance of the liver or any other organ where that drug is being cleared in the body. So that means for this question, our total clearance is going to be the clearance by the renal system plus the clearance by the hepatic system. And that will be equal. So the one for the renal is 60. We're going to add that to the hepatic, which is what? 40. And when we add that together, that will give us what? 100 milliliter per minute. So the best answer that will be what? Will be C. And moving on to the next question. A 69-year-old man is started on a continuous IV infusion of an antibiotics eliminated exclusively by glomerular filtration. So that means that antibiotics is eliminated by the kidney. And after 48 hours, the plasma concentration is higher than expected despite unchange in the infusion rate. So that means our infusion rate or maintenance dose is the same thing. But all of a sudden, the plasma concentration of that drug starts to increase. And the lab testing shows an acute rise in creatinine. So rise in creatinine is telling me that there's something wrong with the glomerular filtration rate. Because if you remember the clearance of creatinine also equals to what? To the GFR. But even though it slightly overestimates the GFR, but we can use the clearance of creatinine to evaluate what's the GFR. So if the creatinine is increasing, that's telling me that there's something wrong with the glomerular filtration rate. Which pharmacokinetic change best explain this finding? So that means that patient is having problem with their clearance. So the best answer there is going to be what? Decrease in clearance. Because as we know, if the clearance is decreased, that will lead to decrease in the rate of elimination of that drug, and that will lead to increase in plasma concentration of that drug. Moving on to the next question there. A patient with renal failure undergoes hemodialysis. A drug with which of the following properties is administered? Very high protein binding, large volume of distribution. Which statement is most accurate here? So if you look at this medication has a very large volume of distribution. That means that medication is going to leave the plasma and go into every tissue. And you can see there it's also high tissue protein bound. So because it's high tissue protein bound, that means that drug has a very high volume of distribution. So because it has a very high volume of distribution, that means the plasma concentration of that drug is going to be very low. And because the plasma concentration of that drug is low, that means dialysis might not be the best to remove that medication from the circulation. So the best answer there is going to be B. So dialysis will minimally increases what? The clearance of that medication, because it has a very high volume of distribution. Because when you are doing dialysis, you are dialyzing the blood, and whatever that's inside the blood, that's what you are able to dialyze. So a drug with high volume of distribution might not be a good way. Dialysis might not be a good way to clear those medication out of the body. The next question there, two patients receive identical IV infusion rates of the same drug. And patient A has twice the clearance of patient B. Which outcome occurs? So they are telling us here that patient A has twice the clearance of patient B. So that means if patient A has twice the clearance of patient B, so that means patient B has a higher is going to have a higher steady state. Because if patient A is clearing the drug quickly, that means that if patient A is clearing the drug quickly, right? If they are clearing the drug quickly, so that means their steady state is going to be is going to be lower because of the increase in the clearance of that medication. So that means in this case, patient B is going to have a higher steady state. Because if you remember from our formula, remember we said that the steady state equals to infusion rate divided by the clearance. So that means if the clearance is high, what's after the steady state? The steady state concentration will be what? Will be decreased. And that's why patient B will have a higher steady state. And moving on to the next question, a drug is cleared. 70% of those drugs are cleared through the liver and 30% are cleared through the kidney. A patient develops renal failure, but the hepatic function remains normal. Which changes is expected? So if the renal, if that patient develops renal failure, but the hepatic function is still normal, as we can see here, majority of that medication are cleared through the They are cleared through the liver. So that means the best answer there is going to be what? Is going to be B. Very good, because there will only be mild decrease in the total clearance. Because when you look at total clearance, it's going to be the combination of clearance by the liver and the clearance by the kidney. So even though the kidney is mildly affected, but the good thing about the drug is that drug is mainly cleared by the by the liver. So that's why the clearance of that drug will be mildly affected. The next question there, which is question A. A substance has a urine concentration of 120 and there's a urine flow rate of 1 milliliter per minute, and the plasma concentration is 2 milligram per ml. What is the clearance? As we know, the clearance equals to excretion rate, and excretion rate is going to be urine flow rate multiplied by the urine concentration of that substance, and we're going to divide this by the plasma concentration of that substance. So looking at here, they give us the urine flow rate, which is 1, multiplied by the urine concentration of that substance, which is 120, divided by the plasma concentration of that substance, which is what, 2. And if we multiply this, that will be 120 divided by 2, and that will give us what, 60. So the best answer there will be what, B. Let's go to the next question. A patient's measured value, so the inulin clearance here is 100, and as we know, unit clearance is also equal to what, GFR, because your unit clearance is the same thing as GFR, and the pH clearance is 500, so that means pH clearance is also equal to what, renal plasma flow. So that's also equal to renal plasma flow. So here they're asking us what fraction of the renal plasma flow is filtered. So what they're asking us here in question 9, they're asking us about filtration fraction. So that's what they're asking us here. And as remember, we know that filtration fraction is going to be GFR divided by the renal plasma flow, right? And our GFR here is 100, because we know that the clearance of inulin is the same thing as the GFR, and the clearance of pH is the same thing as the renal plasma flow. So we want to divide 100 by 500, and then when we divide that 100 by 500, that will give us 0.2. And when you convert that to percentage, that will be 20 what? 20%. So the best answer there is going to be 20%. I'm moving on to the next question. A patient has a urine pH concentration of 100. Again, so our urine pH here is 600, and the plasma pH concentration of 2, and a urine flow rate of 1. And here they are asking us to calculate the effective renal plasma flow. And as we know that the effective renal plasma flow equals to the clearance of pH, and clearance of pH is going to be urine flow rate multiplied by the urine concentration of pH divided by the plasma concentration of pH. And then when we multiply this out, so here they give us our urine flow rate, which is 1, multiplied by the urine concentration of pH, which is 600, divided by the plasma concentration of pH, which is 2. And then when we multiply this, this will be 600 divided by 2, and that will give us what? 300. So the best answer there will be D, which is 300 milliliter per minute. And the last question for the day, guys. The renal plasma flow here is 600. Hematocrit is 40%. What is the renal blood flow? As you remember, we know that our renal plasma flow, the renal plasma flow is equal to renal blood flow multiplied by 1 minus hematocrit. So from here, we can make the renal blood flow the subject of the formula, and that will equal to renal plasma flow divided by 1 minus hematocrit. And as we know, our renal plasma flow here is what? They already give it to us, which is 600, and our hematocrit here is 40%. So we have to convert this to decimal. We have to be 0.4, and it is going to be 600 divided by 0.6. And once you divide that, that will going to give us what? 1000. So that the best answer there will be 1000 milliliter per minute. Guys, we've come to the end of today's lecture. Please don't forget to like, subscribe, and share with your friends. And I will see you guys in the next video. Bye.